Welcome back to the final part in this series on tongue tumours. We're talking about Coco, who's a dog that presented with melanoma on his tongue. Hopefully you find these Langford Academy recordings useful, and if so, please do subscribe to our channel because it really helps our audience grow. And if you could like the video and comment below, that will help as well. So far we've seen Coco. He's been referred to us at Langford. We found a melanoma on his tongue, and we've done some sort of fairly reasonable staging. We've not found any spread of that so far. So despite this, melanomas are quite metastatic tumours. So even if it hasn't metastasised currently, we're going to have to warn these owners that it still could have metastasised, but it's just that it's not been detected. Based on the FNA and the appearance, we're fairly confident now this is melanoma, but because of the red pigment, this will be the subtype of an amelanotic melanoma, which is why it's not pigmented. These are normally more aggressive, and the head and neck tumours are also a bit more aggressive, so we need to be a little bit cautious about this dog in terms of what we offer the owners and being realistic about the prognosis. Despite this, in this case, partly because of the location, it being fairly accessible, the owners did plan to go ahead with surgery, and so we did go ahead and carry that out. With tumours like this, as I mentioned in the previous part, we usually want to take at least 2 centimetre margins because that means we're going to get a complete primary tumour excision. And so we've got to plan a little bit about how we do that in Coco. So based on the location, it's not going to be possible to do like a partial resection, so a wedge or something like that. We do need to do a transverse glossectomy, 2 centimetres proximal to where the tumour is. One of the key things we're going to need to consider during surgery is hemostasis, because as you can imagine, the tongue's got a really good blood supply, and if we were to cut into that without doing something to stem the bleeding, we could get quite spectacular bleeding during surgery, which might be quite difficult to control. So typically when we do a transverse glossectomy, ideally we want to use something that's going to provide some hemostasis, so either electrosurgery, a laser or a harmonic scalpel if you've got this equipment available. If you've not got that, or in addition to that, what it's quite nice to do is place something higher up the tongue to act as a tourniquet during surgery. Typically, I'll use a Doyen bowel clamp, so just a standard intestinal clamp. And what you can do if you place that more proximally on the tongue is you can use that to keep the tongue protruded during surgery. So it can be quite helpful just to keep everything in place and stop things moving. Another option is to pre-place some mattress sutures across the tongue. And again, particularly if you focus those on the midline, that can help to slow the bleeding during surgery. And you would then plan to remove them at the end. So for Coco, that's what we did. We placed a bowel clamp on the proximal end of the tongue, and then we used a harmonic scalpel to do a transverse glossectomy. There was some bleeding during surgery, but it wasn't too extensive. We did place additional sutures on the lingual arteries when we came across them, and that really helped to slow the bleeding down. Once we did that, we then needed to close the site where the transection had been performed. And typically we're going to do this by opposing the mucosa on either side, the dorsal and the ventral side of the tongue. So usually we'd use either a 3/0 or 4/0 absorbable suture. I quite like using something braided in the mouth because I find it's less irritant on the other soft tissue, so I would use Vicryl for this. There's a bit more drag when you pull the suture through the tongue, but having those nice soft ends in the mouth I think is quite beneficial for the dog post-operatively. So here's the picture of the tongue before we started, and here's now the image at the end of surgery, and you can see a row of simple interrupted sutures there just opposing the mucosa on either side of the tongue. So as I said earlier, we've done a transverse glossectomy, so we've cut proximal to the mass, 2 centimetres upstream, and then we've sutured the mucosa across the wound there. Because this one was slightly on one side, our glossectomy ended up being a bit more diagonal, and we were actually able to bring some of the tongue from the left-hand side over to the right, which helped with the closure. So post-operatively, usually these animals cope fairly well initially, and particularly if we hand feed them soft food in the short-term future, they can tolerate that very well. So this dog was eating really well on the same day as surgery, so he didn't seem too fazed by the surgery at all. Unfortunately, despite our best efforts, dehiscence is quite common in these cases. If that does occur, we'd usually leave those to heal by secondary intention. So I find that reoperating, you just cause more irritation, and there's usually a reason why these wounds have broken down. So it's likely to happen again unless you do something differently. Equally, they do heal really well by secondary intention. So despite it looking a bit odd initially, if you leave it alone, it will re-epithelialize over time, and the dogs don't seem too bothered by that in the short term. We've mentioned already that cats don't cope particularly well. So if you were planning a glossectomy on a cat, I'd recommend placing an esophagostomy tube at the same time, just so that you've got a mechanism of getting food into that cat in the immediate post-op period until it starts eating by itself. So I mentioned that dehiscence is quite common in these cases, and for Coco, unfortunately, there was complete dehiscence of the tongue. We'd already warned the owners this was quite a high possibility, and it did happen. So you can see now with the open mouth view here how big a glossectomy we did. So we did probably take around 50% of this dog's tongue, but as I say, that didn't really affect his ability to eat or drink. He coped very well with this, which was great. So despite it breaking down, ultimately did go on to heal well. After a couple of weeks, we got the histology back, which did report an amelanotic melanoma, as expected. We got 2 centimetre lateral margins, which was what we'd planned to, so that was really good news for him. And they reported 1 centimetre deep margin, but in reality, that was the thickness of the tongue was about 1 centimetre. So that's, again, what we expected. So all good news for him so far. The slightly worrying thing was that actually the mitotic index was really high. So for dogs, we say anything above mitotic index of 5 is a high-grade tumour, and his mitotic index came back as 111, so really quite a high one for him. But despite that, we've got no current signs of METs, and we've got clean margins. And actually, despite our concerns, Coco did go on to do really well. So he had a 2.5-year survival following his surgery. Unfortunately, ultimately died of seizuring, which we suspect could be metastasis to the brain, although we never did any further diagnostics to confirm that. But overall, I think from our point of view and the owners, this case went very well, which was really good news. Didn't have a very good tumour, but actually had a really good quality of life following surgery until ultimately died of something that could be related, but we're not quite sure. So that's it for this mini-series on tongue tumours. We've talked through how the case presented, further diagnostics we performed, and ultimately the surgery that we used to treat him. I hope you found this video useful. If so, please do subscribe to our channel because we've got lots more content coming in the future. Thank you.